Good morning. I want to say thanks to Bonalive, thanks to Frederick for an invitation. I am a diabetologist, and so I want to say, speak about, just for the first slide, for diabetes mellitus. Diabetes mellitus is one of the most worrying health problems in the world today. We know there are 500 million people has diabetes, and the food problems are the most serious, costly complications of the disease. Osteomyelitis represents a particularly challenging condition with diabetic foot with an associated high risk of major amputation, and so requiring a multidisciplinary team approach in this treatment. When we have osteomyelitis, the major problem is to obtain a complete resolution of osteomyelitis with no surgical procedures and no additional cycle of antibiotic therapy. So, in our center, from 2016 to 2018, 40 diabetic patients affected by chronic osteomyelitis of the foot underwent surgical debridement and were followed up until August 2018. Well, they were divided into two groups, each of 20 patients. Group A was treated with surgical debridement and a local application of bioactive glass. Group B was treated only with surgical debridement. Well, systemic antibiotics were also used in both groups, and most of the patients had previously undergone other procedures. So this is a characteristic of the patients, and I'd like to underline two aspects. First of all, the site. In the group A, we had 4 patients with a lesion localizing in hind foot, and the group B, just only 2 patients. And the other very important aspect is the peripheral revascularization, because in both groups, in 15 on 20 patients, we made angioplasty. So they were difficult and complicated diabetic patients. This is our results, and at a mean follow-up of 12 months, 6 to 18, with an overall rate of 90%, 18 of the 20 patients in group A treated with bioactive glass showed a rapid resolution of the osteomyelitis and no signs of the infection recurrence. In the group B, with an overall success rate of 60%, 12 of the 20 patients in group B treated exclusively with debridement showed a resolution of the osteomyelitis. In 3 cases of recurrence, we performed debridement again coupled with a local application of bioactive glass, and we observed no further recurrence in the following 12 months. This work is an object of the next paper, because this is a very interesting result. About the wound healing, there were no statistically significant difference between the soft tissues repair time in both groups. And so testifying that the local factors of the soft tissues, microcirculation or numerous comorbidities, play an important role, with the only difference being that these tissues are less likely to become infected in the bioglass treated patient group. And this is one clinical case, a female of 68 years, 3 months before start lesions to the first metatarsal of the right foot. And we can see the osteomyelitis in X-ray, surgical debridement of the osteomyelitis, and stabilization of the metatarsal ray with the device, arthrodesis, and bioactive glass. And this is the results, where we can see after X-ray, after bioglass, 1 week after, and then 9 weeks after in this patient. And another clinical case, this is a very complex patient with diabetes and dialysis and previous forefoot amputation with a plantar ulcer, with osteomyelitis of a cuboid bone. We used the bag, and you can see the X-ray imaging after 1 year from debridement and local position of bag. So, conclusions. One, the use of bioglass allows a more conservative treatment, as we limit ourselves to removing all the osteomyelitis focus initially identified. Two, the antibacterial properties of bioglass allow to overcome doubts and uncertainties in determining the extent of the bone that should be removed in the osteomyelitis. Three, it is shown that the number of cycles of antibiotic therapy is reduced in patients treated with bioglass, reducing the cases of resistance. And finally, the achievement of the primary healing endpoint with the resolution of the chronic osteomyelitis allows all these patients not to undergo new surgery, new hospitalization, and possible new complication, contributing to a considerable saving in health costs. And so thanks to all my team. Thank you very much.